change I want to see must first begin in me. I surrender so your world can be changed. The change I want to see.
Two extremely promising vaccines.
Moderna showing a 94.5% efficacy rate.
Pfizer now says its vaccine is 95% effective.
The next monumental challenge, delivery.
This is an undertaking unlike, I think, anything mankind has done before. I mean, we're literally talking about vaccinating every man, woman, and child on the planet.
The logistics are daunting. Not only do vaccines need to travel thousands of miles, they need to be kept cold.
Temperature is everything. These vaccines need to be kept cold. Some of them need to be kept frozen.
At Chicago's O'Hare Airport, ground crews have just 4 hours to unload and reload giant 747s that crisscross the pole.
You need to move the product as quickly as possible.
This is one way vaccines will reach their destination. We toured DHL's giant Chicago warehouse before the two potential vaccines were announced. Here, temperature is everything.
It's a lot colder in here. How cold is it in here?
This is 2 to 8 degrees Celsius.
Specially designed containers can be set to maintain cold during the flight.
Extremely cold. Really cold.
For extreme cold, the Pfizer vaccine needs to be kept at negative 94 degrees. Containers are also packed with dry ice. Once a vaccine arrives, the race against the clock begins.
Hopefully, from the time it leaves the manufacturer until the time it gets to the final distribution center, no more than 2 to 3 days.
Drug companies like Pfizer will keep close watch when its vaccine hits the market.
We're tracking, planes and trucks with precious vaccine in our shipper, and we're tracking the temperature as well.
When there is a vaccine, it will take some 8,000 fully loaded 747 cargo planes to deliver 1 billion doses to the U.S. market.
An enormous logistics undertaking for all shippers, from FedEx to UPS to DHL.
Recently, we expanded our cold chain facilities here in the U.S., opening up Indianapolis with a $1.6 million investment.
Are you ready?
Yes, we are. We're ready.
In the race for a vaccine, time and temperature are everything.
If they're looking for you, Jesus, let them find you in me. If they're looking for you, let them find you in me. If they're looking for you.
Well, good evening. It's time once again for Real Talk. I'm Dr. Linda Housey, and I will serve once again as your host. I'm so glad that you have chosen to be with us on this afternoon, this evening, for our Real Talk session. I want to first thank our sponsors, the Mississippi and Western Tennessee District Council, with our Bishop Clifton Jones, and our chairman, Stanley Jones. And now we have our Commissioner Willie Simmons, and our Senator Sharita Simmons. So I want to do a shout out and say thank you for your support and for your endorsement and working with us to make sure that we get the message out concerning this COVID-19. Once again, our guests are here, our panelists are here, and they are behind stage, and I'm just gonna ask them to come on. Once again, we have Dr. Cummins. Dr. Johnny Cummins is the director of the Aaron Henry Center in Clarkston and Batesville. Am I right, Dr. Cummins?
Well, yes, but I'm primarily in the Batesville site.
You're primarily in Batesville. Welcome this evening. All right, we have Dr. Lakeisha Richardson with the Delta Regional Health Center in Greenville. Hi, Dr. Richardson, how are you?
I am well, how are you?
Yes, and she's also a OBGYN. Thank you for joining with us. Well, we have a new person that's with us on this evening Dr. Simone Moore, and she's with the Delta Health Center, a pediatrician there in Mount Bayou. Welcome, Dr. Moore. How are you?
I'm doing good. Thank y'all for having me.
All right. Well, we're just going to start this conversation. Many of us have been fully vaccinated, and we see that every day things are increasing as it relates to what we can do or what we cannot do. First, I want just to start with, give us some updates, Dr. Cummins, as to what is going on now.
Well, the major push right now is the various COVID vaccines being introduced into the arms of people. The new administration has given us for the United States of America, a goal of getting over 100 million. We've already pretty much got close to that already by his first 100 days in office. This past week, there were 4 million, almost 4 million doses given in one day. So I think that's part of the push, but the other part of the push is for us not to get too comfortable and complacent. Even though we have the vaccine and it seems successful, we have not yet arrived at the nation being at least vaccinated at about the 75–80% of the total population. And when you look at the world population, we're not even close. So the virus, it needs to be mitigated to a point where we can suppress it and stop its spread. So we're still in the midst of this COVID-19. People are still getting sick. People are still being hospitalized. People are still dying. We have hope with the vaccine, but the myths that are still there and the fears are still there about the vaccine. And so we must encourage the people to continually strive to get past the myths, the fears, and take the vaccine, because this is the only thing that's going to allow us to have a sense of normalcy as we go further into this year.
Dr. Richardson, will you talk to us about herd immunity? How can we work together to possibly get there? I know the news say that we are a long ways from that.
Absolutely. So the fastest way we can get there is actually to get vaccinated. You know, a lot of people are still on the fence about whether or not to receive the vaccine, but I still feel, like we said in our last talk, if you have the opportunity, if you are within the range of where you qualify for the vaccine now, I really recommend that people get vaccinated as soon as possible, whether it's Johnson & Johnson, Pfizer, or Moderna. At this point in time, you really can't be selective about which vaccine you want to receive. You just need to receive the vaccine that is available in your area.
All right, so to follow up on that, what are you saying to the women that are pregnant? Should they go for or not?
It depends. I think that's a conversation that they definitely need to have with their obstetrician gynecologist. I definitely recommend it depends on where they are in the trimester of their pregnancy, whether or not they choose to receive the vaccine. But if they're postpartum and they're breastfeeding, then I definitely recommend that they receive the vaccine.
Okay. All right. So Dr. Moore, welcome again. Talk to us. What are you seeing that at the health center as it relates to children? What are you all saying to parents? You know, we're getting back to school in person. So what are you all recommending for that?
So with children, it's a bit of a different story than it is with adults, because I get that everybody wants to get back to their regular life, but most children are not qualified to receive the vaccine. Anybody under the age of 16 still has not received the vaccine. So we're kind of hoping that if we can get to herd immunity based on the adult perspective in the parents in the household, that will make our kids better able to go to school. A lot of schools are still on the fence whether they're going to open next year or they're going to be virtual. We're hoping that schools give kids a sense of normalcy, allow them to go back, but it would need to be with the same precautions that we've had all this time. Because yes, we have been quite fortunate that mostly kids do well with it, but we don't know what the long-term side effects of COVID is going to be, and so we don't know what their lungs are going to look like in 20 years. So that makes us nervous, because yes, kids do great now, and what are they going to look like in a little while? So it's kind of hard to say And it's going to really be based on your school district and how safe they feel like they can keep the kids.
Okay, I just heard a couple of days ago something about, they had been talking about 6 feet in school, but now they are talking about 3 feet.
So
yeah, y'all talk to me about that.
That is again a tough one, because we hope, when I say we as physicians, 6 feet is probably going to be what makes us most comfortable. But I think they're trying to find a way to make it more feasible for kids to get back to school. So that keeping 6 feet away, you're just never going to be able to get people into a classroom. And so we think that maybe the 6 feet may have been pushing it, but just trying to keep people safe. And 3 feet may be okay, but there's still not a whole bunch of data to prove that. For kids' sake, also 3 feet away for a kid is not going to be the same as an adult, because within 3 feet, I can reach out and touch you, and kids are going to do that. So it kind of makes it a little touchy.
Okay. So now that many persons have gotten the vaccination, so how long is this vaccination? Anybody chime in? How long is this vaccination supposed to last? Or would I have to go going back every year? In the future, what is the research saying?
The jury is still out. A lot of researchers are suggesting through following people who've been vaccinated in the United States and abroad, they're saying 6 months to maybe even a year. But we don't, you really, there's no real concrete answer to that question. So it may be a year, may be lifetime, but like the flu vaccine, you have to get a booster every year for the different strains. And it's apparent now that because we have not mitigated the COVID-19 virus properly, we have all these different strains, these mutant strains that are various in their aggressive nature to the human body. Some aggressive toward you getting the disease, some more aggressive toward getting severe disease and hospitalization and possible death. So I think the jury is still going to be out. We still need to stay the course and get vaccinated toward what Dr. Moore's talked about, herd immunity. We are definitely nowhere close to that in Mississippi, nowhere close to that even in America, even though we're doing better. And the world, we're only about 1.8% of the world population is fully vaccinated. So it's given opportunity more for a continuous spread of these new strains, these mutants, viruses that are going to impact how effective our vaccination pool is going to actually be in the general population. So we still got a long way to go.
Well, I want to come back to that question, but first you mentioned the death rates, the hospitalization. What are you all seeing now at your clinic? Has the rate gone down? Has it remained steady? Or has it gone up? What are you all seeing on a day-to-day basis?
Well, in our practice, we don't test quite as much, or we don't have that patient that comes in that give us that key to say that we need to treat them in our COVID protocols. But we still find that people are still getting the virus. They're being hospitalized, and some people are even still yet dying. We still have not passed that threshold. So yeah, it's not as much as it once was. I think the COVID vaccine has taken place over the virus itself, but the virus is not as prevalent in our communities as far as symptoms are concerned.
I think with kids, for the most part, when you saw kids getting tested, it was return to sports, return to school, or they had spent the vacation somewhere with family members, so they wanted to be sure, or they came in with their parents. And so the Delta Health Center, when we were doing mass COVID testing sites, we were seeing with kids, our numbers have severely dropped, and I'm not necessarily sure if that means that we're getting less people in the community that's sick, or people are just writing stuff off as codes and not necessarily COVID, which we kind of feel that could be problematic in the long run, because then they become carriers and passing it on to other people in their families.
What are you saying, Dr. Richardson?
I'm seeing a lot of asymptomatic moms test positive, pregnant patients testing positive from baby showers, gender reveals. So I can't really say if that number is decreasing or increasing, but I'm still seeing pregnant patients test positive who are asymptomatic just by screening to be admitted to the hospital or screening for delivery. So, and then people are still dying in our hospital as well. Not as often as they were in the middle of the pandemic, but people are still succumbing to this illness, unfortunately.
With the adult, just one moment, with the adult population ambulatory outside the hospital settings or getting surgeries, asymptomatic people we don't test, and so we miss a whole lot of probably what Dr. Richardson is saying, a whole lot of asymptomatic people who may be positive or maybe carriers, because again the focus is now on the vaccine, and the people, the disease seems to be decreasing, but I know it's still out there.
So am I hearing you all say that you all are not doing as many tests per day as you all were before?
Not as many.
Okay, all right. Now, for a person that says that this vaccination is going to only last me for 6 months and I got to come back, how do we have a conversation with them to say, even though it's 6 months, you still need to go on and get this vaccination? Because a lot of skepticism saying, well, it's 6 months. I'm going to continue to wear my mask. I'm going to continue to do this. I hadn't gotten it so far. So what makes me think in 6 months that I will have it? So I would just take my chances. So what conversation can I have with a person that says that to me?
So I think the biggest thing to say to someone like that is that I think that at this point, as much as people, if you want to get out and about, you want to get on planes, you want to travel, you want to start back somewhat of a normal life, I think that 6 months of coverage is better than no months of coverage. It allows you to, yes, you still need to wear a mask, but at least you can go out and feel more safe with going out. And so if your safety only lasts 6 months at a time, it's better than no months at a time, and with the risk of getting it. And the risk of passing it on to your family members. I've seen a lot of people, it seems like, especially younger people, it's easier to convince them to protect their family members rather than just protect themselves. So I think it's important to preach both points.
I agree. Remember, this is a new virus to the human body, and so our initial encounter with it was devastating. But now we are building up immunity in the sense that our body can recognize this virus more efficiently. And so we can build up an immune response. That's what the vaccination is for. But because of the different strains, there may be need for boosters, because these strains are proving right now to still be subjected to these vaccines. But if we keep allowing these strains to continue to produce themselves because we're not mitigating the virus properly, we're going to be in for a long haul. And instead of thinking that by September or the end of the year we can come back to a sense of normalcy, we might be going back into a whole new cycle. Wow. Because we're not doing the things that we need to do across the board. It's too early for us to be comfortable and complacent with this disease, because it seems like it's gone away. It's still lurking in the shadows, and we need to be paying attention. We haven't finished the course yet.
So my question is, if one has been fully vaccinated, can they still get the virus?
Yes. But your symptoms may not be as severe, or they might be, depending on the individual. You still don't know the impact of this virus on people, because you got all these strains coming forth, and everybody's responding differently.
And I think it's also important to remember, because I've seen in a lot of households, again, from the pediatric standpoint, I see a lot of household where mama has it, dad has it, and then grandma has it. And so it's like, well, let's go ahead. We can take our mask off. We can do whatever we want to do. But kids are still not vaccinated. So, yes, y'all feel like y'all can do all this stuff. But eventually what you're going to do is pass on to your kids. And then it may be a stronger strand. They have difficulty. Kids are going to, we fear that kids are going to start to have more difficulty with it because everybody else is immune from it. And so you're going to see increasing cases because people have gotten too comfortable.
Okay. So I know they're working on a vaccine for children now. When are they projecting for that to be completed?
Right now, I have not seen any clear projections of when it's going to be completed. Because originally when it came out, it said 18 years old. Now we've pushed it to 16. And then they have started entering more pediatric patients into the trial. But from my understanding, it's not going to be like 16 all the way to just birth. It's going to be in smaller increments, like 16 to 14 to 12. But I think we may have a little while. There's no clear projection at this time of when that's going to be available from what I've seen.
Have you all seen anything different?
No.
Okay.
No.
So we really don't know when the youngsters will be vaccinated as of yet. Okay, so nothing's out there.
If they are, it still won't go past 12, not initially.
Yeah.
Okay, so the study is on from 15 to 12. Is that what I'm hearing?
Mm-hmm.
Pfizer, mainly.
Okay, all right.
And from my knowledge, Johnson & Johnson hasn't done anything on kids. It's just been Pfizer and Moderna.
The Johnson & Johnson vaccination, some say that that's not the real vaccination because of their one shot and their rate of accuracy. What can you say to us about that?
Let me say it like this. A vaccine in the arm, I don't care which one, is better than a virus in the lung. Period. Because all three of them are 90 to 95% effective against severe disease, hospitalization, and subsequent death. So they're all equal at that level. And Johnson & Johnson's one shot gives you almost 75%, at least 75% protection, which is better than the flu vaccine, which gives maybe 50, maybe 60%, depending on the year. So the vaccines are projected to be still effective.
Okay, so if I have been fully vaccinated, why do I have to continue to wear a mask? That's what I'm hearing. Y'all told me to come go get my shots. I've gotten my shots. Now you're still telling me to put my mask on. Talk to the audience, let them know why we still need the mask. As you know, Mississippi have banned the mask, or they have lifted that requirement. So why do I still need to wear my mask?
Because we don't know exactly. We hope that this is going to prevent disease, and we hope that it is, or if you were to catch it, it's going to make it make it less severe. But that is also just the hope and what we've seen from the vaccine thus far. You could be an anomaly, and you could be the person that even though you've had the vaccine, you can still get severe disease. And also, you're going to risk passing that to people in your family or in your community that have not been vaccinated or have chose not to be vaccinated for one reason or another, or the kids that have been unable to get vaccinated.
The numbers don't lie, Dr. Housing. In Mississippi, fully vaccinated, about 500,000, a little over 500,000 Mississippians, which is about 16.8, almost 17% of the Mississippi population. In the United States of America, you're talking about 61 million, which is going to be about 19% of the total population in America. And then when you look at the world, we're still talking about 1.8%. So the percentage wise, as far as wearing the mask, we're protecting people from us, and we're being protected from the people, because remember, we still can get the virus even though we're vaccinated because of all these different strands. And so we need to really be proactive and keep wearing our masks, because the masks are effective.
So even though you're fully vaccinated, you can get another strand of the virus.
It's a possibility.
So you're vaccinated only from one strand or one type of strand?
I wouldn't say it quite like that. I mean, because these, Dr. Richardson, Dr. Moore can see if they agree, but these different strands, depending on where they are, where they come from, it may be more aggressive than the ones we've been accustomed to. Even though we are vaccinated, they are developing strands that may not be subjected to the vaccine. So our body's got to be ready to build up a whole new response.
So is that why that they're still doing testing now to see what strand that the Pfizer fights against and what strand the Moderna fights against? Is that why the testing is continuously going on?
Yes. Plus, the virus has one objective, and this is what we need to embrace completely. It is to survive. And if we don't stop it, it's going to get worse.
Okay. All right.
I think the worst thing that we can do with this pandemic, vaccine or no vaccine, is to get complacent. And I think that we are getting into a point where we now have larger amount of people vaccinated. We're tired of wearing our masks. We're tired of sitting at home, and we're getting complacent. And complacent places where things like viruses just wreak havoc.
Yes.
So it's getting warm now. We want to get out with our friends. We want to go out to eat. I've seen a lot of them on Facebook and say, this is my first time out eating since last year. So now I'm going out. I'm having family gatherings. So you're saying now I'm breeding once again COVID-19.
It's a possibility.
Strong possibility.
Okay. All right. So one question that came in, and I want to ask you all this. Since I've taken my vaccination, should I continue doing this vitamin D, vitamin C, and the zinc, even though I've had my 2 shots?
It won't hurt.
About that?
I think it's more important that you continue to wear your mask and wash your hands and follow the social guidelines for COVID-19.
Yeah, it's like I tell all my patients when they bring over-the-counter supplements, I say it won't hurt you. It depends on you as an individual what you feel comfortable. You've had your vaccine. It's not proven that it's going to do any more or less, but it's depend on the patient's comfort zone.
All right. So I still need to take all of my rituals that I was taking at first.
Well, don't say it quite like that. It's based on the individual's viewpoint, because this is not proven one way or the other after you've been vaccinated.
Okay. So we really don't know if my zinc will help me against the next strand that I got.
I'm sure it will.
Okay. Now teachers are very nervous. Now many of the schools open back and the teachers are there in person. So talk to the teachers, and what advice would you give them with the children back there with them? Many schools have opened back. How can they keep themselves safe?
I would recommend that they definitely create a routine for their classroom. And I think that it needs to be personally designed by them or followed by the CDC guideline, because what their school may put in order or what the governor may put in order, depending on what state they live in, may not be really what's safe for them. So say like Mississippi right now, we don't have a mask mandate. I would still recommend that a mask be worn in the classroom. The teacher needs to wear a mask. The students need to wear a mask. They need to wipe their desk down with Lysol when they enter the room. They need to wipe their desk down when they leave the room. Like, you need to have cleaning protocols in place if they're going to be in class full time. And the teacher needs to set that standard. And that needs to be part of, first day of class. We're going to wash our hands. We're going to wipe. You're going to cover your mouth when you cough. And that needs to be strict, and they don't need to be lenient about that. And I think that's the only way teachers are going to be able to keep themselves safe if they're going to have a classroom full of kids next year.
I also think that something that I've seen in other school districts that seem to have worked well for people that have started back to school is putting the dividers in between desks, because at the end of the day, kids are going to be kids. They're going to touch each other. They're going to laugh. They're going to joke, because it's harder for kids to see how serious this pandemic is. And so I think you need to have your routine, clean, wear your mask, but you also need to have dividers. And it doesn't hurt to have dividers and keep your kids with their mask on. Again, just to decrease the amount of chances that your respiratory droplets can come in contact with each other. I mean, I think we should think twice about putting kids back in the lunchroom, and sitting next to across from each other. It's better that kids sit at their desk. And I understand how much we want our kids to be socially interacting, but at this point, we have to protect our kids' life and their grandparents and their parents as well.
I agree, and I believe that that each system need to have a central rule and should not allow an individual to say, well, I don't believe in masks, and so I'm not going to enforce that. If we're going to have masks, we need to have in our systems, regardless of states lifting mandates, we need to know that masks are what's needful and necessary along with the vaccination. But right now, everybody can wear a mask, even though everybody's not vaccinated. And so we need to be protecting ourselves and our children from the next wave, whatever that's going to be.
I also think it's very important that it needs to be, like you said, Dr. Lakeisha said, that it needs to be a school-based plan. It should not be government regulated. It should not be state regulated, because those people think politically, whereas the school systems should not. School systems should think about what's best fit for that child. And I also strongly caution people that coronavirus as a whole is a winter virus. And so as our numbers look like they're great right now and these other strands are coming out, I would caution people, once we hit the schools and they start back in August, September, and November, roll their necks, that we could be seeing a second wave that's worse than this one if we go back to school and not do the proper things.
Yeah. And then I would definitely urge superintendents or anybody who's in leadership for school districts, protect your teachers. We know that kids are going to be vectors or they're going to be carriers, but you have teachers and educators in your classrooms that are high risk. They have diabetes, they have asthma, they have chronic hypertension. They still fall in this category where they are high risk for coronavirus and possibly dying from the coronavirus. And unfortunately, we can't all decide to retire because of the pandemic. We can't all decide that we're going to take a leave of absence. So it's up to us to protect, our employees and our educators during this pandemic.
It is very important that superintendents take the time to consult a doctor that has been keeping up with COVID and that knows what's going on to try to make their plans. I think that it is very hard for somebody that has only been watching the news to make a plan for their school district that's going to work for everybody.
Very good point. So you were saying individualize the plan for every school, and the teachers need to do whatever they need to do in their classroom to individualize that, to ensure that they are safe as well.
Yes.
So I keep hearing about the different variants. What are you all seeing here that have hit our state or surrounding states?
I hear of maybe several strands that are developing differently, but I don't think we're doing enough testing on that to say one way or the other. It's just that if you don't test for it, you won't see it. And so we're and right now, so it's hard to answer that question with any certainty. There have been some strains that have been identified in Mississippi, 1, 2, 3 at the most. But I believe that every human host can produce a mutant strain. I mean, once it gets inside the body, it can do whatever it's going to do.
Well, you keep saying that we're not testing for the various strands. That's like we were doing in March of last year. Why we end up where we are now? Because we were not doing the proper testing for the virus.
Well, March of last year, we didn't have the testing to. We were experimenting on testing then, and so.
So why have you all stopped testing? That's what I want to know.
I mean, still, if we test, it's not going to say we're going to get strains. We're just going to test positive or negative.
I understand, but I'm saying, why are you all, for what reason have they slacked back on testing? Maybe that's my question.
The vaccines took the front seat.
And then I think too, we're seeing a lot of vaccines. Like you were seeing a lot of people out doing out COVID testing in different communities now, and so they have used all of those resources now to start trying to get vaccines. And I also think that once you start displaying symptoms of COVID, whether you test positive or whether you test negative, it doesn't change your management. So people have moved away from testing everybody, and if they have said symptoms, you just treat it like COVID and move on, kind of thing. Because it's still something that once you get it, it's symptom-based that you treat it. And so we have moved more away from testing and more of how to manage that and how to get vaccines out as fast as possible with hopes that our numbers will fall.
Okay, all right. So the focus now is on the vaccine in opposed to testing. And am I hearing you say that if a person comes in with the symptoms, y'all just treat it just like it's COVID, keep on rolling, and
no, we do. We still most health centers are still testing. That's not what I'm saying. Sorry, but a lot of times I think that is the thought process at home. It's like, oh, we have it. My cousin has it, so this one has to be what it is. And so people aren't coming in as frequently to get tested. And I think we have started blaming our common cold stuff on just common colds that we get all the time that may be COVID, but we're just not testing anymore. They're not febrile and not having body aches and not having more severe symptoms. And it's also the availability of tests have gone down since the rollout of the vaccine.
Okay. So now we're going into the spring season. So everything now is my sinus.
Right. Especially in the Delta.
Even if I lose taste or smell, it just might my sinuses making me do that.
Okay, all right. Well, while talking with the commissioner, Simmons, he was very concerned about our numbers still in the Mississippi Delta. And he was very concerned that we are still not, people of color still have this stigma as to why I should not be tested. And because the ministers, the church has been out. So, Easter came and a lot of churches opened up, brought us back together. So what do you say to that? And how do you speak to the churches since they want to go out, they want to go back, and their parishioners are saying, we miss everybody, we need to get back in the building. What do you say to pastors and to leaders about this? I'll start with you, Dr. Cummings, since you are twofold, a pastor and a doctor.
Well, my initial phase, because I am a practicing physician as well as a pastor, I thought best that I would protect my people from, because I came with in the initial phase would come in contact with potential COVID patients a lot. And so now, remember, we only still have less than 20% of the state fully vaccinated. So that means that when we come into the church house, most of the people in our circle will not be vaccinated. And so if we're not going to wear our masks and we're not going to social distance and we're not going to keep good hand hygiene, we're putting ourselves at risk for getting the COVID-19 virus and these strands, these new mutant strains that we're not necessarily testing for in Mississippi. And so, you remember the initial phase in March, a lot of members of churches were getting this disease that brought the highlight on this disease in March of 2000. And now we're in April of 2021. And now the churches, when you talk about gathering, on the scale of 1 to 9, the nightclubs and other places where you can get the highest surge of virus from close contact. At the level 8, you know who was on level 8?
No.
Churches.
Wow.
Because we're gonna get happy, we're gonna get complacent, we're gonna let our guards down, and then we're gonna start hugging, and then we're gonna start talking. And if we can just see what comes out of just our conversation, not our cough, just our conversation, how we project things. And so, and it's still traveling through droplets, and it still can touch a person. So we still, like Dr. Moore said, we don't need to get too comfortable or complacent about this disease. We need to have this thing on the forefront of our mind, because if we don't, it's going to actually get worse. So yeah, I would ask us to be cautious about, if we're going to come together, make sure you got everything the CDC recommends, and that when you get in the house, that there is, in the church house that I'm talking about, that there is rules that you are strictly going to be governed by.
So, Dr. Richardson,
2021 moving forward.
Okay, thank you. Can you give us? He just mentioned some rules that we need to be cautious about. Can you give us some that a leader needs to, as they put their COVID plan? So I guess just like the school needs a COVID plan, the church needs a COVID plan. Am I right?
Right. We need to follow CDC recommendations. And Dr. Richardson, go ahead.
So I would definitely try to keep members 6 feet apart. Definitely tell members, no hugging, no congregating after service or before service. And then definitely, if you are a religion that does communion with the same cup, that needs to be changed. You need to change communion to individual communion pieces, so that you don't share. And then those would be my recommendations.
Get rid of the water fountains.
Yes.
Nothing like that. Make sure you have posters, that you have signs up, and so that people come in each entry place and exit place, you have a posters signifying what's the expectations, and you constantly rehearse that, and you don't get comfortable.
So do we need to do temperature checks coming in?
All that.
Okay.
Whatever the CDC recommends, and we need to follow those recommendations. And just because we might be in rural areas, don't take those places for granted and take liberties where you say, well, we out here in the rural, nobody know what we're doing. That you will know, and the Lord knows.
All right. So what about the use of the mics? Maybe some churches don't have 5 and 6 mics, and so they move the mics from one person to the other. So what do y'all recommend to say to that?
Either limit mic use, or it needs to be wiped down in between uses.
Black churches, we need a mic to talk in, okay?
One of the first, the first cause of large cases of COVID in the initial phase was people using the same telephone.
Whoa.
Without cleaning it in between, and then letting it dry. So you need at least 2 to 3 mics.
I'd also be very cautious with large congregations with big choirs, just because the more someone talks, the more at risk you are spreading respiratory droplets. And so every time they sing a song, you're just increasing the risk. And so if you can cut it out altogether and play pre-rehearsed music, I understand how horrible that is for some churches, but it is safer for your congregation.
I mean, I would almost recommend, to change the service or shorten the service so that you come to hear the word of God and go home. All that extra that we do, no offense to you, Pastor, but you're really coming to receive the word of God. And if you want to keep people safe, you want to limit the amount of exposure, you want to limit the amount of time that you're gathering, and so that they come in and receive what they need to receive so that they can return home safely.
Dr. Richardson, I do not take offense to that because I'm in both worlds. I have to walk a fairly thin line between understanding the spirit of things and the legalistic awareness of what's expected in our earth world. And a lot of people say that they're not going to take the vaccine because God going to protect them or he's going to heal them. And those are things that we need to be more educated about don't take God for granted. He allowed things to occur. And so our flesh is not going to where our spirit person is going to be allowed to travel. And so if you're ready to go to where God is, that your flesh go back to where it come from. So we need to really be educating our people about the religious aspects of things and the medical aspects of things and get rid of all our myths.
Okay, yeah. Wow. Yeah, as I said, we're coming back together for funeral services and big crowds, and we are not being safe. We're not doing 6 feet. We're just coming together, and it is customary that when we see each other, the first thing we do is we hug each other. That's just who we are. We are those type beings, we just social beings. So you're saying to us that disband the choir?
We're saying that complacency this early is just too premature.
And
it is much easier to miss somebody that is still here on this earth than to miss them when they're gone. So
right.
Take it like that too.
Okay, and I hear only let the preacher preach. Once you come in, go in there and you sing one song, and the preacher needs to be able to sing, and he needs to preach, and we all go home. And
I don't know about the singing. I don't know about the singing part, but we'll speak a little bit and then we'll go home. Yes.
Okay.
But I think one of the things we can do across the board is start using the social media platforms, even when we go back into the assembly place, more efficiently and effective. Start having screens like Dr. Moore said. We have pre-recorded song service with not but maybe 4, 5 people who are our song leaders and stuff like that. And we just got to start being innovative in how we do our worship services and how we meet and greet each other as we come into the house of prayer. So yes, it's going to be a great challenge for us.
All right, now I have a question. We first I want to talk about how do we tell them about giving? Or we just need to go to online giving, or do we need to still with our tithes and offering giving? You know how it is. So you walk in the church, the usher gives you the envelope, and we pass the thing, and we count the money. How are we going to do that?
Well, at the end of our Zoom platform, we have this way of giving. We have 2 ways of giving. We can use We use the
Cash
App, and we have people can actually come in a small community and drop it off at the secretaries, because everybody knows where the secretary lives.
Okay.
And that kind of thing. But I just think, that's all. This is just my opinion. I don't. This is not anything etched in stone. But because I guess I have a viewpoint of the religious and the medical community, I form my own viewpoints and opinions that are not necessarily the standards. But I know we shouldn't get comfortable and complacent.
So you're saying that each leader needs to evaluate their congregation, look at the CDC guidelines, and come up with their plan of action. Is that what I'm hearing? Okay.
Yes.
I want to talk about travel. We all been cooped up for a whole year, and persons that is used to traveling, they're ready to go. So what do you say if I'm fully vaccinated and I want to travel? There's some controversies as to should I or should I not? So what are you hearing on the latest with that? Anybody stab at it?
Okay, now that's like everything else is constantly changing.
Right.
At one point, the CDC was talking about for people who are fully vaccinated that you maybe 1 or 2 or 3 days before you travel, you get a COVID test. Now they're saying maybe you don't have to have a COVID test if you're fully vaccinated, at least 2 weeks after your second dose or 2 weeks after dose of Johnson & Johnson. But when you get ready to come back home, you have that test before you come home, and then once you get home, 5 days later or so, you have another COVID test, because we're going to go on vacation. We're going to be in environments that we otherwise would not be in. And some people who we travel with, if we're on the plane, most of the people on the planes are not going to be necessarily fully vaccinated. So we're going to come in contact with a lot of people that are not following the set rules that we have chosen to be governed by.
So I also think that I understand again that people want a sense of normalcy, but I would travel with caution, especially on airplanes, because airplanes are closed spaces with recycled air. And so yes, you may be vaccinated, and with hopes that if you were to catch COVID, that it would be decreasing your symptoms and it wouldn't be as bad. But if you're on a whole plane, you're the only person that's vaccinated and everybody else is COVID positive, the likelihood that you're going to get a strand that you're not vaccinated again or a severe case strongly increases. I'd also be very cautious, because if you decide to travel, that whatever you are doing to stay safe here, you do the exact same thing to be safe in your new location. Yes, it is assumed that all hotel rooms are wiping down every surface and spraying it with Lysol. The same thing for the rental car that you get. The likelihood that they are spraying down every single surface is highly unlikely. I would strongly encourage, if you feel the need to travel, to wipe down everything you touch, especially if going into a place that you're going to stay in for a couple of days. Wiping down all the surfaces yourself, spraying all the surfaces yourself, because again, you just need to do what absolutely everything you can in order to decrease the chance that you'll get it. But I think what I'm seeing a lot is people are traveling with kids who are not vaccinated, who are now not wearing masks. And so I just feel like we are only slowly, basically, we're slowing down the progression, but the inevitable is going to be that all these kids are going to catch it because they're not vaccinated, their parents aren't wearing masks, we're going out and travel, and they're just going to be carriers for things we don't want.
So in other words, you're saying stay home.
If you can, yes, but travel at your own risk and be cautious.
In short, stay home. It's not time really to travel yet.
It's not the right time to live your best life.
No, you can travel in your car, short distance, and away from people. But you know, if you get on the plane, you have to be real cautious and be careful.
I also think it's important to notice that we are one of the few countries that have open travel amongst ourselves into other countries that are allowing travel. Most countries are still in lockdown, most of your bigger European countries. And so although we have decided not to be overly strict, that other countries are seeing the importance of staying at home.
So is that why possibly that their numbers are so much better than ours?
As probably has a large factor to do. My brother-in-law actually lives in London, and the barber shops, grocery stores, all that stuff is still shut down. I mean, we're a year into the pandemic.
Whoa.
Yeah.
Wow. So, and we here in America, we'll still
living our best lives every day.
Well, what we need to really embrace is that a lot of our decisions about COVID-19, wearing masks, and even the vaccination is an economic thing. And we value economy over people's lives. Not we as individuals.
But could it be that we've had so many missed messages? You know, for instance, travel, you can. Travel, you can't. 3 feet, you know, 6 feet was ingrained in our heads. You know, y'all have preached 6 feet, 6. Now we're here, well, 3 feet.
I think it's important to think of COVID sometimes as a person that you just met a year and a half ago. And really just a year ago for most of us. And so you don't really know anybody in the first couple of months, and we're learning just like everybody else is, and we're just trying to get the information out as fast as we can.
I like that. I'll take that. I'll take that.
Yeah, some people you just don't want to be around. The one thing, let me say this before you go further. When we left the mask mandates in Mississippi, the one thing you saw happening was our restaurants that had been 25, 30% full if they were open. Now they're almost full. Yeah. And you got everybody just talking all over, eating and talking, and the tables don't have any distance in between them. And so people are they're just not paying attention. And I just hope we still be a little cautious.
Well, that's the question I was going to ask you. So, you know, this going out to eat. So, you know, they're opening up and they're inviting you. They're running all kind of specials now for you to come indoor dining, you know? So, and I just can't really figure out how to eat with my mask on. I ain't quite got that yet.
You just think about it. In your mind, just think about it. I'm eating, but you're really not. I'm just.
I can't quite get there yet. And personally, I'm skeptical even about, just like Dr. Moore said, the safety even at the restaurants. Are they really doing what they should be doing? Are they spraying down? I know I went to a pizza place. One of the kids wanted some pizza, and the guy was back there on his cell phone. I was at the drive-thru, and he's out there on his cell phone, and his mask was under his nose. And I'm like, oh no, I'm not eating this pizza. Because I didn't feel that they were going through the proper, even though I'm sure they had protocols there, but I question the carrying out, because as I said, as you all said, that people are getting a little lackadaisy now because they're just tired of everything. So they're just saying, okay, you know, we'll just go on and we'll just do it, and whatever happens will happen. So what can you say to a person that's saying, well, I'm just ready to go out to eat with my friends?
Yeah, I can be a little bit, I guess, more morbid than some. Are you also ready to potentially be intubated? And so that's really not that fun either. And so sometimes you just, again, benefits have to outweigh the risk. And so it's all of what you're okay with happens. So if you're okay with being in the hospital for a couple of weeks, possibly being intubated, I mean, I think, again, that we've gotten complacent. The fear has not changed from COVID-19. The symptoms are still the same. It behaves the same. And we have to be mindful of all the side effects that we've seen. And I think what we as physicians are failing to preach is not the initial COVID vaccine. Not the initial of you getting COVID that makes us extremely nervous. Is what you're going to look like 10 years from now that we have absolutely no idea how to tell. And I think that should be as scary to you, if not more scary, than actually getting COVID now, because you can be asymptomatic now, and then what you'll look like in 10 years, we have no idea.
No. The other thing is, even though the disease is seemingly decreasing, the hospitalizations are decreasing, the death rates are decreasing, people are still dying every day. And you don't want to be the one person that's severely ill in the hospital or potentially dying, because once it's you in your house, that's 100%. You can't fight that number.
Yeah. So I hear a person say, well, we go to Walmart, we go to Kroger, so what's the difference? What is the difference with me having my friend over if I'm going to Walmart, if I'm going to Kroger's?
Because the likelihood in Kroger that you're going to take your mask down and not be overly comfortable is a lot less likely than when you have your friend that you talk to all the time. You're going to take your mask down. You're going to accidentally get too comfortable. You're going to hug. And it's just, and I feel like we've gotten to the point where we're used to COVID in the grocery store. So we're going to wash our hands. We're going to make sure that we limit touching. We're not going to be overly close to people. We'll still separate ourselves. But we get comfortable with people we know. And so we assume I look at you, you look fine. You look at me, I look fine. So we can hug, we can touch, we can get close. And it's just too soon.
Okay. I agree with that. We're going to open it up and see if there are any questions in the room. If there are anyone that have any questions, because I've given you all many of the questions they sent to me earlier, wanting to know those things. So that led me with the questions that I was asking you all about this COVID-19. I've taken my second vaccination on Friday. After my 2 weeks wait period, will it be safe to go to the fitness center during a non-peak time?
That's like everything else. If you're going to go non-peak times, you make sure that you take your own cleaning supplies, and everywhere you go, you wash it down before you use that particular fitness device while you're in the fitness center at non-peak times.
And don't forget to wear gloves.
So you all are advocating gloves now? You know, one time we was going to use gloves, the other time we're not.
These are gloves like not these leather gloves, something that can, and then you may say, well, I'm not going to use this again.
All right, so you're saying to get the plastic throwaway gloves if I'm going to the fitness center.
Yeah, and then change them from machine to machine, because if you have COVID, you also don't want to spread it to the next machine. And so I'm talking about like guys that are lifting weights in that bench press the single bars and stuff. That kind of stuff can be vectors because you're pulling it up to your mouth, you're breathing on it, you're pushing it back up. And so you get right on that machine behind the next person. You don't wipe it off. You don't have vaccines. The first thing you do is wipe the sweat from your face. And I mean, there's your spread.
So with that being said, if I'm walking, do I need a mask on?
Yes.
Now I'm gonna fall out there walking with this mask on now.
You can walk at the walking track with no mask if you're not gonna come close to somebody.
Because I'm out there every day on that walking track. So you said I need a mask in my my pocket just in case I pass somebody along the way, kind of put it on and then afterward take it off?
When they initially talked about the impact of the COVID-19 upon us in the early phase in March, where they could say a person behind you could cough and travel and get on your coat or on your body, and you can touch it and do that. So the possibility, they don't speak of that as much now, but the possibilities of that still occurring is still there.
You're gonna have me tomorrow morning, got a mask on my face on the walking trail. All right.
I mean, if you're out there by yourself and you know you're gonna be alone, I mean,
oh no, that's the whole group that's out there all on the track. So, you know, there's a group that walks every morning. And so we pass each other, you know, as we walk. So I guess we just put a little mask on in our pocket. And as we pass, now, one lady actually gets off the track. She gets off the track and she moves until she passes everybody. And then she gets back on the track. Well, I guess that could work, huh? So in other words, we still need to be safe. We still need to continue doing what we've done before, not become complacent. Is that what I'm hearing?
Yes.
Basically, buckle down for another summer.
Pretty much. Don't get COVID fatigue.
Okay. Now, before I go, I need to know about the nursing homes. What's going on with that? Because a lot of folks are saying, I want to go visit my mom, touch my grandfather or my dad in the nursing home. So what are the restraints now with those facilities now?
The initial push of the vaccine was for that population. And so a lot of that population did get vaccinated. So everything is still, you still want to be cautious. But the possibilities of that population being visited by family members who have also been vaccinated now is greater.
So they will let you in now to see your loved ones?
Yeah, if vaccinations have been completed.
Okay. So one
still wearing masks though.
Okay, still wearing a mask, and you have to bring your card with you, I guess, to show that this emphatically has happened. Okay.
If they don't trust your word.
All right. Before we go, I just want each one of you all to give our audience once again some parting words that we can take. We see still in the Mississippi, our numbers are still going up. Even though we had gone down, I was looking at the numbers that we are going back the wrong direction. And as you said, Dr. Cummings, we're still dying. But okay, before y'all give me this, I want to know, this is just personally me, as relates to the church. They didn't ever stop. We stopped. And it seems like we died. And is it that we didn't know that they were dying?
That's a question that's a mystery. Still.
Okay.
It's hard to say what you think in public about that matter.
Okay. that has always been in the back of my mind, you know, how are we dying, and maybe because we have many of the underlying health conditions that makes us more susceptible through this disease. And
they're dying too. They're just not telling you that.
oh, or we don't have the room to actually isolate because all of us are staying together. You know, grandmama, grandfather, the children, the sons, the daughters, and the grandchildren. So maybe that's why we don't. Well, anyway. So before we go, I need some departing thoughts for my audience that are listening in, because we have a whole group that's listening to us today. What will you say to us? Now we are a year out, and I'm hearing you all say there's no time soon.
Don't be complacent and appreciate the moments that we do have. I understand how much we miss touch and how much we miss people, but I feel like social media has greatly stepped up to try to bridge those connects. So use those to your best advantage, whether it's Zoom, Snapchat, Facebook, whatever floats your boat, and just realize that we're going to get to a point one day where we can get back to normalcy. But the more that we fight or make this more political and economic and care less about people's life, the longer this will go on. And so I think that it comes to a point where you as a person need to listen to physicians and what they are telling you more than what politics is telling you, to do the right thing, because the longer we listen to let everyone else tell us what we should do, the longer this pandemic is going to last. I think people could greatly benefit from seeing how the flu first came around, how long it lasted, how many people it killed, because if we don't do better than they did, we will be them.
Okay. Dr. Richardson?
I would just advise people to just be creative. I mean, I feel us as physicians feel the same pain that you're feeling. We're tired of being in the house. We're tired of going to work every day. We're ready to travel. We're ready to go back to our CME meetings and see our colleagues and see our friends. So we're not advising you to do something that we're not doing as well, but we've gotten creative. Lots of platforms are offering free workouts. You know, if you're missing a gym, if you feel like you need to get active again, there are tons of services that are offering free workouts. You know, get creative with, if you want to eat out, have a picnic in your own backyard, front yard, you know, fix your own food and go sit outside, go sit on the lake if you live in Greenville like we do, or on the levee while you're still in your car. You know, be creative with your families, get on Zoom, schedule Zoom meetings with your cousins or with family members. But there are lots of ways to connect with family and friends and church and colleagues and still stay safe. You don't have to just sit in the house and just keep waiting on a day where they say COVID is going to be over with, because in reality, COVID is going to be here for us for another year, another 2 years, who knows? So you might as well get creative now, start making plans, start living life differently, because going back to normal will not happen anytime soon for us. So you might as well settle in and settle down.
Wow. Thank you. Dr. Cummings?
I agree with Dr. Moore, with Dr. Richardson. We cannot get comfortable, complacent with the fact that we are tired of COVID-19, and I've been vaccinated now, and I've had the virus, and I have some sense of immunity, and I'm not afraid of it anymore. And like I say, religious people say, well, the Lord gonna take care of me. Yes, He is. But let us be realistic about it. And we need to have the same message coming from religious leaders and secular leadership, because the people are confused, and we can't break the myths or the fears if we keep giving them mixed message. So the people need to hear the same message from the state house and the church house, and those who be leaders of both sectors, if we are to survive this moment in our history, which I believe is a critical moment for our continuation as a nation as we know ourselves. Because if we don't do better, the nation as we know it will no longer be.
Wow. So you're saying, am I hearing you all say, from the Easter break that we've just had, that you remember they used to say a wave of 2 weeks or 7 days, be cautious? So I'm hearing you all say that after this break, we still need to be cautious.
Yes. Travel over this weekend was at an all-time high during this period of COVID-19. 2 weeks from now, 3 weeks from now, we'll see whether that actually had a negative impact upon what we see happening.
And we should also consider that most kids are going on spring break within the next 2 weeks. And I feel like that is going to see a spike in the numbers after that as well. Because parents have been locked up with these kids on virtual for over a year, and they are looking forward to traveling.
So I'm hearing y'all say, buckle down just a little while longer. Well,
Dr. Hauser.
Yes, sir.
Those that wait on the Lord. He will mount us with wings as of an eagle.
Yes.
Let us run and not be weary. Let us walk and not faint. So let us be patiently and wait on the Lord here.
Yes. Yes.
But do what we can do to help ourselves.
Yes. Yes. So, Dr. Richardson, so we're going to get creative and we're going to find different ways that we can come together as a family to do the things that we need to do. Well, I thank y'all once again for coming on, sharing with our listening audience. And we will be back on May. It's May. See, now I can't keep up with the months. The months fly by, the days fly by. I have to look at them like, what is today? You know? So on May 1, the first Monday in May, we will be back having another discussion and update. And I want to thank my panelists for coming on, sharing with our community information that will help us. Thank you, thank you, thank you.
Good night.
Good night.